Good morning, guys. We're all sparkly. The internet can be a very dangerous place because the information on there is not regulated. Any Tom, Dick or Danny can start a podcast, sound confident, try and flex his muscles and tell you what you think you need to hear. When you come to the men's health clinic, you'll be told what you need to hear. Why? Because it's necessary to effect a positive change to you, the individual. And I know what I'm talking about. I don't spout vitriol. This video is done as a response to two videos I watched last night. Utter nonsense. One TRT expert doctor was talking about the differences between male and female glycolysis and how glucose and insulin resistance cause anxiety. Fundamentally incorrect. So, what causes anxiety on testosterone replacement therapy? How long have you got? Have a look at the previous videos I've done. It's complicated, but it's not because of increased insulin resistance. Another video, they were talking about hematocrit. And unless you had hemochromatosis, there are no other pathologies that raise hematocrit. What? The most commonest, outside of an incorrect protocol, the commonest cause of a raised hematocrit with healthy hormone levels is obstructive sleep apnea. COPD, smoking, the list goes on. But say with confidence and people will believe you. Fucking hell. Literally absurd. So, let's talk about hybrid TRT. What combining transcranial testosterone cream with injections to give you strong wood. Libido, erections, super complicated. Wow. How long have we got to talk about libido and erections? Wow. Stress is the major negative impacting factor on libido alongside male androgen levels. Stress is incredibly complicated. What? Erections, again, a complex mechanism involving your nerves, your vascular system, your hormones. Scary times we live in. Oh yeah, so with confidence, it's fine. You know, I know. You don't know what you're talking about. It's utterly absurd. You get companies that are there literally to sell you testosterone replacement therapy. If you approach the men's health clinic, and I don't think you clinically need testosterone replacement therapy, I will give you some pointers as into what you should do. If you need to lower your SHBG, lower that. If you need to address your sleep, address that. If you need to address your diet, address that. I don't want to prematurely put you on testosterone replacement therapy, but if I think it's in your best interests, I will suggest it. A guy emailed the other day and he'd got borderline levels, but a raised SHBG. So I sent him a whole information pack about how to lower SHBG. And he said the company that he approached before just simply weren't interested. Shock horror, because they couldn't sell you TRT. So they're not interested because they can't make a profit out of you. Lots of the work I do is advising you why you don't need TRT. What a stupid model I've got. No, because if you don't need TRT and I put you on TRT, you won't feel the benefits because you need to address the things that we've spoken about ad nauseum before you'll really truly appreciate normal male androgen levels. You get some moron saying just keep upping the dose to make yourself feel better. You raise your testosterone, you raise your dopamine, which makes you feel good. You raise your estrogen, raises your serotonin, your happiness chemical, makes you feel good. What happens when your levels stabilize? You don't feel as good, and you've now got high levels. So you have the complications of raised hematocrit, raised blood pressure, lipid dysregulation, and being a bit of a twat. What we want you to do is have a considered reaction to the situation. And what allows you to do that, in part, healthy male androgen levels. So DHT, aggression, libido, testosterone, drive, determination, motivation, estrogen, empathy, insight, understanding. All of those things have to be in balance for you to have a considered reaction to a situation. If, say, your estrogen's massively elevated, you will start arguing with randoms on the internet, randoms on Reddit. You will fiercely defend your opinion as if it's fact and not accept the fact that people can have different opinions, as if your whole sense of self-worth and self-esteem is based on being correct on a platform where you will never agree, because you're not actually communicating, you're spouting. Clinicians try not to make closed statements because they realize that that is foolish. So yeah, hybrid TRT, injections as a base and transscrotal testosterone cream to give you the extra boost in libido and sense of well-being. Now, what happens? Essentially, with daily dosing of testosterone via injection, you should, in principle, achieve stable levels. The daily injection protocol will allow for a spike, and as we know, your testosterone follows a diurnal pattern with a spike in the morning, which kind of makes sense. So if you don't feel the benefits, it's likely that something else is going on. As you guys know, we microdose testosterone and HCG because the HCG not only preserves intratesticular function, it also allows for stimulation of your neuroendocrine system, which is why people feel an improved mood and libido with HCG typically. So why would you add transscrotal testosterone cream? It rubs the lotion on its skin or it gets the hose again. Well, you do this because essentially, if you rub the cream onto the testicles, you'll get a spike of DHT alongside a spike of testosterone. There will be extra stimulation of the 5-alpha reductase enzyme, converting more testosterone to DHT. And as we just said, DHT, we like DHT, aggression, muscles, sexy time. But with excess DHT, there are risks. What are these risks? Well, it's actually linked with cardiovascular problems, a rise in blood pressure, lipid dysregulation. So do you want to spike DHT? Well, I do because I want a high libido. Look to other things to improve your libido. With healthy male androgen levels, you shouldn't need to spike DHT to improve your libido. We always want to promote safe and effective care because we want you to be on TRT forever. Why would you not want to be on TRT? You've had negative symptoms, and with healthy male androgen levels, those symptoms at least stand a fighting chance of being resolved, because not everything is TRT. If you've got issues with your metabolic health, you need to address your metabolic health. If there's trauma that's happened in the past, TRT is not going to magic away that trauma. It will help your mental health, but you need to work. And as I say all the time, earn your reward. If you put the effort in, you will see the reward with male androgen levels being of the optimal range, not super physiological. So one of the things as a doctor, it's do no harm. It's always act in the best interest of the patient. Now, disappointingly, the NHS and lots of other clinicians want to preserve healthy levels, but they don't really understand it. So their emphasis is more about disease prevention. And they're obviously indoctrinated by the pharmaceutical industries, and they don't have the time or inclination to really analyze this and understand, if we went back to hunter-gatherer, woke up, hunted, gathered our food, had a bit of nookie, went to sleep, and then rinse and repeat, we would be healthy. We're the only species on the planet that has to think about and try and modulate our activity, our eating, to be healthy. All other animals are cracking on and living according to their physiology. They don't have obesity. They don't have the levels of illness and disease that we have as the highly evolved human species. Mental. So, in summary, don't trust the bozos. Go with what makes sense. And yeah, go earn your reward.